You're listening to Her Brilliant Health Radio, episode number 15.
She used to deliver babies, but now she delivers exceptional wellness for women. Welcome to Her Brilliant Health Radio, where holistic women's health expert and board-certified OBGYN Dr. Kyrin Dunston shares revolutionary insight from leading experts on what you need to know today to treat the root cause of disease, heal, and create the radiant health you've been searching for.
Hey everybody, it's Dr. Kyrin. Welcome to another episode of Her Brilliant Health Radio. Today I have a special guest who's going to talk with you about fixing your fatigue, Dr. Evan Hirsch. Dr. Hirsch suffered with chronic fatigue for 5 years before he achieved resolution using the Fix Your Fatigue program. He's going to tell you all about that today, that he pioneered in his medical practice. Through his best-selling book, free Facebook group, and one-on-one coaching, he has helped thousands of people across the nation resolve their fatigue. And he is on a mission to help 1 million more. He is board certified in family medicine and integrative medicine. And when he's not in the office, you can find him singing musicals, dancing, and playing basketball with his family. Welcome, Dr. Hirsch.
Thank you, Dr. Kyrin. Thanks for having me on.
Glad to have you here. I'm so excited for you to talk about the process that you use with fatigue with clients. But first, I want to talk about your journey, because I know a lot of people think that we as physicians enjoy great health, although if you look at the average physician, you can see that that's not true. But sometimes they don't know exactly how much we are suffering. I know it was true for me. So talk about your journey. What was going on for you, and how did you find the answers you were seeking?
Absolutely. So when I got into residency in family medicine, I met my wife about a month or two in. And we had, a wonderful love affair. And then 6 months later, her adrenals were crashed out and she had chronic fatigue. And so I asked everybody that I knew while I was going through residency, specialists and whatnot, and nobody could really help. And then I started doing a ton of research on it. And, 3 years later, she was most of the way better. And I graduated residency, and then I crashed out and I got fatigue. And so, I was gathering all this information. I was really able to help my patients and help them get better. I learned a lot from functional medicine, learned a lot from environmental medicine, did different trainings and learning more about toxicities, and all that helped my clients. But then I got this chronic fatigue and it was awful. I could only work a couple hours a day. I had this big staff at that point. I had graduated residency, started my own practice, had to bring on other practitioners that then I had to train so that they could support all this overhead that I had. I had all this body pain. My brain fog was awful. I couldn't remember anything. And then I started treating myself. And so I was already kind of in the functional medicine mindset, but I wasn't a good patient. I wasn't good at prioritizing my health like a lot of people aren't in the healthcare field. And so then I started applying all these things. And what I found was that I had pretty much every single cause of fatigue. And I would treat a cause and I would get a little bit better. And then treat another cause, I would get a little bit better. But it was only when I found all of these causes that I really achieved amazing health and amazing energy. And that's what I see all the time in my clients, is that they've been treated a little bit, and so people are trying this, that, and the other thing, and they're like, okay, I took some adrenal stuff, I took some thyroid stuff, and it gave me a little bit of a bump, but they don't realize that they have to explore and treat all of the causes in order for them to achieve the best energy of their lives.
Yes, and I apologize for all that movement. I actually had to switch my mic and put my headset on, but you're absolutely right. And I just want to step back for a second, because as a board certified medical doctor, I really wasn't taught much about evaluating people and treating them for fatigue, probably like you. So what did we do when people came to us and said they were tired? We might do a hemoglobin and hematocrit. We might do an Epstein-Barr virus and a mono. And we might check your thyroid, but just a TSH and a total T4, not a full thyroid profile. Anything else you can think of we might do as regular doctors?
Well, then the serious stuff like cancer
Cancer.
or,
Mm-hmm.
heart failure, lung disease. But yeah, the general ones are the ones you recommended. Yeah.
Right. And so fatigue really remains one of the big, what I call black holes in the doctor's office. It's really not addressed. And that's where I think functional medicine shines, is with these diagnoses that are really descriptors of symptoms, but they're not really diagnoses that tell you what's causing it. And it sounds like you had that, but then you discovered a bigger world. So how did you discover that, and what opened for you?
So really it was just curiosity. It was coming from conventional medicine, asking a lot of questions of my attendings in medical school and residency and not getting answers. So then I went into, I learned about American Holistic Medical Association. I got board certified in holistic medicine while I was in residency. I learned about integrative medicine and then functional medicine when I came out of residency. And then environmental medicine was really great for helping me with learning about heavy metals and chemicals and molds. And then I did specialized training in infections to learn more about how to treat those, because, for me, it's really about, okay, where are the holes? When I hear different things from my patients, it's like, okay, who's doing what that's working that I'm not doing? What do I need to learn in order to get to the next level? Because I could get people better to a certain level by replacing their B12 and replacing their hormones, let's say. But then there was this group of people who I couldn't get better. And so those are the people who have all these toxicities that we're going to talk about more in a little bit. But it's constantly learning more and plugging those holes so that I can treat anybody who walks in the door with fatigue.
Right. So when you got better, you started working with other clients, and now it's become your life's mission, sounds like, to help 1 million people fix their fatigue.
Yes.
Which is awesome. So talk about your 4-step process that you use in helping people with fatigue.
So the 4-step process that I found that really works, the first step is to assess. And so this is really to figure out what all those causes are, because what I found is that there are 15 different causes of fatigue, and everybody has different causes. So that's why those treatments that, my best friend over here took for their fatigue helped them, but didn't help me, because they had adrenal dysfunction, mold, and Epstein-Barr, and I have Lyme and thyroid issues. So they can be completely different,
Mm-hmm.
and so what they took doesn't work for me. So you have to assess, and you have to test for everything. So everything that is all the deficiencies and then all the excesses. And so, yeah, so let's kind of dive into that a little bit in terms of the
Okay.
assessment. And so in terms of the deficiencies, we're looking at deficiencies in hormones, adrenals, thyroid, sex hormones. We're looking at deficiencies in nutrients, B12, vitamin D, magnesium. We're looking at deficiencies in water. So people who are living chronically dehydrated, deficiencies in sleep, deficiencies in exercise. And then with the excesses, we're looking at heavy metals, chemicals, molds, infections, allergies, negative emotions or trauma, electromagnetic frequencies, parasites, dental cavitations or hidden dental infections. So those are kind of the two groups, deficiencies and excesses, that we want to assess. And then step 2 is replacing those deficiencies. Because what I found is that you got to get people strong before you try to get rid of the crap. Because by boosting their adrenals and their thyroid and their nutrients and their sex hormones, so many things come back online. Their energy goes up several ticks on the scale. They're better able to function in their daily lives. They're better able to take care of themselves, make good food choices, which we know is so important. So that's number 2. And then step 3 is detoxification. So then you start to open up the detoxification pathways: liver, kidney, lymph, skin, breath, stool, all of those things. And then you get rid of the crap. That's step 4, which usually takes the longest amount of time, 6 to 12 months generally. So we like to get there as soon as possible. First couple months are the first couple steps, and then the rest of it really is the last. And so that's getting rid of heavy metals, chemicals, molds, infections, all the toxicities that we're being exposed to in this world that our bodies really aren't, made for. 100,000 pounds of mercury being dumped in our oceans every year, 84,000 chemicals that we're exposed to in products on a regular basis. Half of the homes built in this country have water damage, and most of those have mold. And then our exposure to all of those things cause a whole bunch of these infections to become opportunistic, and so they start causing problems in our bodies. So
Yes,
that's the
and
process.
yes, and I love that. It's very aligned with my philosophy, which I like to say: bad stuff out, good stuff in, balance everything. And you've got the assess in there first, but it's so true. I agree with you that you really have to get a certain amount of strength and balance in people before you start removing things like heavy metals in particular, because it can be very hard on the body. So I usually have people go through a whole first set to get them stable before we do that. So I love that process. And you know what, I want to back up for a minute, because some people listening are probably thinking, well, do I have fatigue? I don't know if I have fatigue. Maybe I do, maybe I don't. Some people are probably pretty clear. But what is a definition that you would give someone? How would you let them know that they were fatigued? What would you be looking for, or questions asking them?
So I tell people that if they are tired and it's not relieved with rest, then they have fatigue. So this could be, you exercise really hard and then you get a good night's sleep, and you're still not well rested the next day, or you have some kind of stressor. You have a motor vehicle accident, you have a, divorce or separation, or, you went to medical school, and then you have a hard time, getting out of bed, even though you may have, or people, when they're done with their finals in college, right? You sleep for a couple weeks and then you're back to baseline. Well, if you don't get back to baseline, then you're fatigued. And now it's different. So that's my definition. But according to some of these bigger organizations, you have to then have that fatigue for 6 months before it's even acknowledged, which I think is foolhardy, because you have to, as soon as you start noticing that things are wrong in the body, you have to, as you said, get them back into balance.
Right. Okay, great. Thank you for sharing that, so people listening can know if they go on vacation and sleep late every day and go to bed early and they're not restored after that vacation, then you probably have some degree of chronic fatigue. Right. So you talked about the overarching kind of, and you mentioned the 15 different causes. Pick the top ones, maybe the top 3. And if you just want to talk about the most common things that you see with people, disorders, and what they are and how you address them, that would be wonderful.
Sure. Well, and the reason why I've also set up this 4-step process in the way that I have is because there are a certain amount of people that are going to get better just by replacing deficiencies. So that's really a great place to start, especially for your viewers and listeners, because the people who I see have all of these, or so many of these things. But for a lot of people who are listening, they may just have adrenal dysfunction. They may have thyroid dysfunction, which I think is grossly undertreated. People don't realize the thyroid really is our best cholesterol medication. It is our best anti-high blood pressure medication, and it really supports all the other hormones. So, when women become menopausal, the smoother it is for them it has to do with how supportive their adrenals and their thyroid are. If adrenals and thyroid are robust, then you can have your ovaries go quiescent and you're going to be fine. You're not going to have a lot of hot flashes. You're not going to have vaginal dryness. You're not going to have sleep problems. So they play a huge role. So hormones, and then nutrient deficiencies like B12, magnesium, to bowel tolerance, to make sure that you're taking enough. You take it until your stools get a little bit loose, and then you back off a little bit so that you're stooling every day. So those are the big ones that I would say might be most pertinent. But then, it's going off into some of these other ones. If you do all those things, and I get people all the time saying, I eat right, I meditate, I'm taking all these things, and I'm still not better. And that's when you have to start looking at the toxicities.
Right, and I just want to emphasize what you mentioned. Your thyroid really is your battery, and I call them the major metabolic driver hormones: thyroid, cortisol, and insulin. Those the three musketeers. And then your sex hormones are ancillary to that. But it's so true what Dr. Evans saying, that those main metabolic drivers, if they're solid, you're probably not going to suffer with menopause or female hormone symptoms. But if they are deficient or unbalanced, then when the estrogen, progesterone, and testosterone start becoming unbalanced, I call it the straw that broke the camel's back. People start having major problems and they think, oh, it's my sex hormones. And it's almost never just your sex hormones.
Right.
There are always these other issues. So these major 7 metabolic hormones, those plus DHEA, form this kind of web that I call it the foundation, probably because I'm OBGYN, is the foundation of health. So you got to get that balance. And then I love that you're talking about the nutritional deficiencies, because really in this day and age, as you know, we can't eat our way into adequate nutrition, and the body wants to heal itself. And like you said, there's some people you can just give them those nutrients and then they can correct themselves. But then the category I think you're getting at next, go ahead and talk about that.
Yeah. So, I was going to jump into infections, if that's all right.
Yes, that's what I thought you were going to go to. The really challenging toxicities and infections and
exactly.
Yeah.
And all those deficiencies are really caused by all of these toxicities. So the stress on the body that's caused the adrenal deficiencies and the thyroid issues with the antibodies to the thyroid and Hashimoto's and thyroid deficiencies has to do with the stress on the body. And this could be mental, emotional stress, but a lot of it can be the physical stressors, like these toxicities, and how they affect the body and how they cause stress. And one of those major ones are infections. So, sometimes it's Lyme and Lyme type infections. Sometimes it's Epstein-Barr, but there are some in there that people don't know a lot about that I'd love to chat about for a second. One of them is called Bartonella, and Bartonella is a bacteria that is found in upwards of 50% of all domestic animals. So if you've ever been licked by a dog, oftentimes you have Bartonella, but Bartonella doesn't really come out to play until the immune system gets distracted by heavy metals, chemicals, and molds. And when Bartonella comes out, then you start getting headaches, neck pain, body pain, problems sleeping, anxiety, depression, pain on the bottom of the feet. And this one's really interesting for folks where it really resonates if they've got it, because it's usually misdiagnosed as plantar fasciitis. Oftentimes people don't like to walk around their homes barefoot, or at least it takes a while for that to kind of wear off first thing in the morning because the bottom of the feet are so sensitive. Sometimes pain in the joints of the hand, joints of the feet, muscle cramps, usually in the calves, thyroid issues, sometimes stretch marks. And you don't have to have all of those things. 3 of those things, may be Bartonella. And I've got a quiz on my website that people can check out if they think that sounds like them. But Bartonella can cause thyroid issues. And, serendipitously, I found a way to, I started reversing thyroid issues and getting people off of their thyroid meds, which I was never able to do before, when I started treating Bartonella. I was able to kind of start weaning people off, because I had this patient come in, she was hyperthyroid. I couldn't figure out what was going on because we had just started treating her Bartonella. And we started weaning her off of the thyroid medication that she was on, because Bartonella plays a huge role in that battery, in that thyroid, like you were talking about. So that's Bartonella. There's an infection called Babesia that makes women sweat all the time, but it's different than hot flashes. It's kind of like spontaneous sweating. Oftentimes they'll have a cough with it. They'll have really bad sleep, and oftentimes anxiety to the point of panic and depression to the point of suicidal thoughts. And so that can be this bug called Babesia, which is very much like a malarial organism that causes these fevers that happen occasionally. So all of these can also then put more stress on the body and cause more fatigue.
Right. So these are the infections that aren't really standardly checked for in mainstream medicine. They require special labs, and they're not first line. You have to generally go to a functional medicine specialist to get this checked. So people listening, if you're having some of the symptoms that Dr. Evans mentioning, you could have one of these, I call them co-infections. And so how would you diagnose somebody who's having these symptoms, including fatigue, but some of the other symptoms that might clue you in that they have Bartonella, babesiosis, some of those things?
So there is a lot of crossover, which is why I like to do a lot of testing. I didn't used to. I tried to use my brain, my sechel, as much as possible,
Yeah.
to figure all this stuff out. And I was able to do it to a certain degree, but, I just got back from a conference that talked about, mold and Bartonella and how so similar, their symptoms can be so similar and there's so much overlap. And now we know that a lot of these infections live in the biofilm, in the hiding places in the body, and then they swap DNA with each other. So sometimes these bugs that we're looking at are like, I call Bortezomia, which is a combination of like Borrelia, which is Lyme, Bartonella, and Babesia, Bortezomia. Like it's these combinations sometimes that we're seeing of these bugs. But in terms of diagnosing them, I really like using urine PCR testing, which is essentially urine DNA testing for these bugs through DNA connections, and that's connections with an X. .com, and people can go on there and they can order the test without a doctor's order, and you just have to make sure that 30 minutes prior, or you do 30 minutes of exercise prior to doing the test, or you have a vigorous lymph massage to get all the bugs out before you do the test. But that's a good way. But even the Centers for Disease Control say that these bugs are really clinical diagnoses. So they're based off of the symptoms. They're based off of the practitioner seeing and being like, okay, these are all the symptoms of Bartonella. Which ones do you have? I think they just came out recently, once again, talking about how the Western blot test really is for epidemiologic studying only. It's not for diagnosis. So even the Centers for Disease Control acknowledge that we don't have very good testing. And so we need to use our clinical acumen to determine whether or not someone has them. But we talked about Bartonella, we talked about Babesia, Borrelia, which is classically known as Lyme. People have migrating joint and body pain. So depending on the day, depends on, where the site hurts, and they might have nerve pain as well. But that's kind of the cardinal sign, is that it moves around the body. And then Epstein-Barr, oftentimes people have large lymph nodes, but it's usually if they don't have some of these other symptoms, but they're still tired all the time. And I've addressed all of the other things that I can think of, then we know that it's Epstein-Barr. So that's a little bit on those infections and how to diagnose them.
And in the clients that you work with, what percent would you say have one of these kind of rarer infections who have fatigue?
Yeah, it's pretty high. It's probably 70%. And remember, people coming to see me, I've seen 10 to 30 different practitioners, and haven't gotten relief from their fatigue. So probably around 70%.
And then do you also find a lot of people with chronic mold infections and sensitivity, things like that?
Yeah, molds are huge. Like I said, half of all of the buildings in this country have water damage, and most of those have mold. You don't have to just live in the Pacific Northwest or in Tennessee in order, for you to see a lot of it. The joke is when someone says, well, I'm going to move into the southwestern part of the country, you say, great, are you going to have indoor plumbing? Because, indoor plumbing breaks, and then or there's a flood in the basement. But I mean, it can help. You can dry yourself out by going into drier climates, because the humidity is going to be a lot less, which is going to inhibit the mold and the mold toxins in the body from blooming. But yeah, they're huge. And I tell people you cannot get rid of infections if you have mold. And so always the first thing when I'm working with somebody, if there's any suspicion of mold, we're testing them for mold in their body, we're testing them for mold in their home, we're getting them out of that home if that's the case, and making sure they don't move into a place that has mold, because that's super common. They're just so desperate to get out that they get into another place, and then they're not getting better. We run another check on their home, and then it's like, oh, you just moved into a place that has mold. So incredibly important.
Yes, I had a patient last year who was having not only fatigue that was interfering with her job, but all kinds of strange neurologic symptoms, what seemed like panic attacks, but she wasn't really anxious about something, but her heart was racing. She'd end up in the emergency room. She was having strange neurologic unilateral shooting pains in her face and in some of her limbs, and these seeming disparate symptoms. And finally, she got to me, and we actually diagnosed that she had exposure to black mold. And long story short, it was in her workplace, and it just became a long, drawn out issue. But we got her better, but she did have to leave working there because she worked in a basement of a moldy building.
Right.
And in the Southeast where I'm located, mold is a huge problem just because the air is so moist. Probably more buildings than not have some type of mold. So it's one of the first things that we look at. I know for her, we had done a Cyrex panel. And so that's something that you see pretty frequently?
Oh, yes.
Yes.
Yeah, it's very common in my population.
Okay. And then how do you work with people to alleviate these? Because particularly with Lyme, the standard protocol is antibiotics, but it's really not that effective in getting rid of the infection. So what kind of approach do you use?
So I love to go strong. You know, I want to make sure that what I use is going to work, but I also love using natural stuff because I don't want to hurt people. So I use very potent herbs, which are specific for these organisms. So I'm a big fan of the Byron White formulas, you know, ABART for Bartonella, ABAB for Babesia, AL complex for Lyme or Borrelia. And they work wonderfully as long as heavy metals, chemicals, and molds are being taken care of. But it's amazing how fast you can get people better when you're using very potent herbs. And you're absolutely right. The research, I believe Dr. Horowitz did a study on this and did antibiotics versus, like, I think the Cowden protocol. And they found that when you removed the antibiotics, the infections come right back. But when you removed the herbs, they didn't. So it is very important. Yeah, and then the antibiotics are so toxic on the body for so many other reasons as well, damaging mitochondria and disrupting the good flora. So it's important to use other methods.
And do you think that this is something that people can DIY? People listening are thinking, oh, I think I have Bartonella and I want to DIY and I'm going to look up all these things. Or how does somebody navigate this?
Yeah, there's a lot that they can DIY, and I kind of go into a lot of this in my book that people can download for free on my website or, you know, get on Amazon, you know, in terms of replacing nutrients and stuff like that. But in terms of getting rid of heavy metals, chemicals, molds, and infections, like, you do need some support, a lot of support oftentimes, because there are a lot of nuances. I tell people we're always looking for the Goldilocks dose with a lot of these things. The Byron White formulas are incredibly potent. And if someone does a search online, they'll find stories of people who were helped by it, but a lot of people who were hurt by it because they were in the hands of the wrong people. Sometimes I'll start people off with, you know, a drop rubbed into their hands every couple of days. That's how strong this stuff is. So you have to work with a practitioner who's knowledgeable in them in order to get the benefits.
Right. Thank you for pointing that out. And it's the same with the heavy metals, even sometimes with the natural, quote unquote, chelators that you can get, cilantro and other herbs that you can buy to help detoxify. Vitamin C is a great chelator. Even doing it yourself can make you pretty sick. So most people fare way better when they have guidance. So how do people work with you? Well, and thank you for the free download of the book. We'll put the link in the show notes to your website, fixyourfatigue.org, and you can download Dr. Evans' book for free on his website, and that gives a lot more detail. And then how do people work with you?
So there's several ways. You know, I recommend that people jump into our free Facebook group, which is they can get at through the website, fixyourfatigue.org. There's also a button to apply to work with me if somebody wants to work with me one-on-one. And we do have coaching programs coming out, you know, thanks to your good guidance and support. I see a lot of benefit there. And so I'm excited about launching a coaching program so that I can really help 1 million people resolve their chronic fatigue, because I definitely can't do it just by doing the one-on-ones.
Right. So just like I have group programs that I hold, Dr. Evan's going to be starting a group program shortly. So you definitely want to stay tuned for this, because this is a huge issue.
Mm-hmm.
And something that's very interesting is I usually do a one-on-one consult with everyone in my group program, and we have one going now. So I've recently been doing those consults. And people generally will bring me their labs and get my opinion, and I'll talk to them about the abnormalities that I see, and from a functional medicine standpoint, what the underlying root cause is and what needs to be done. And they'll say immediately, this is what they'll say: oh, so do I need to go to an endocrinologist?
Right.
Oh, so do I need to show this to my regular doctor and they'll help me with my thyroid? Oh, so, and that makes sense because we're trained in that paradigm. However, what I have to educate people, and what you need to get about Dr. Evan and myself, is that we have additional training that looks at the root cause of disease, that encompasses all of these kind of esoteric causes that you're not going to get at your regular doctor's office. And so I have to explain to people, and I'm sure you do too, your endocrinologist won't know what to do with this. Your regular doctor won't know what to do with this. They won't know what you're talking about. They may even tell you it's a bunch of nonsense. I've had that happen. But the proof is in the pudding. When you help people lose 30, 50, 100 pounds, when you help people go from being so tired that they can't work a full-time job to being able to work a full-time job and have hobbies and enjoy their family life again. I'm sure you have that, Dr. Evan. Speaking of which, talk about some of your most memorable patients that you've worked with fatigue.
There's so many. But yeah, I think some of the fastest, most dramatic changes are kind of some of my favorites to talk about, and some of them are, I've got some video testimonials on my website. But it's really about hitting the right buttons in the right order, which is kind of this experience that we bring to, bring people to the next level. But, I had one case of a 45-year-old female who actually came to me, and she was hyperthyroid, and she was having some gastritis. And so I knew, based off some research that I had seen, that there was an association between H. pylori and hyperthyroidism. And so I treated her H. pylori, which is something that usually associated with having an ulcer, or can be. And so we treated H. pylori, and it was like a month that her hyperthyroidism completely resolved. So, that was really remarkable. And then, she got a little bit hypothyroid because she had a number of other causes that we needed to bring up. The Bartonella is really so much fun to treat. Individuals who come in who've got pain on the bottom of their feet, they've got the cramping, and really in a short amount of time, they can see significant improvements in resolving that. I had one guy, in terms of like babesia, I had one guy who came in who had a chronic cough. He was a singer, and he was sweating all the time. He had a chronic cough, problem sleeping. And I was like, well, I wonder if he's got babesia. Let's start on treating his babesia. And sure enough, after one drop, his cough went away. And then he only needed like 3-4 drops. But in several months, he stopped sweating. His sleep was so much better. So many of these symptoms resolved. And it's really just about being able to identify, okay, what is the problem for this individual? Having a big enough spectrum, that you're differential, that all of the potential causes that you're looking at are broad enough so you make sure you're not missing everybody or anybody, and that you're taking into account everything that they're saying, all their subjective experience, all their labs, and you're putting all that together. Because like you said, with the conventional establishment, they're pretty much looking just at the labs. It's such a shame when somebody comes to me, they are obviously hypothyroid, and their life would be so much better if we increased their thyroid. But the doctor said, your TSH is suppressed, which means it's low, or it doesn't look like you have low thyroid on your labs, so I'm not going to give you more thyroid. And it's just they're just not familiar with actually how the thyroid works, some of the consequences, the real consequences of not having enough thyroid, like having a heart attack or a stroke, among other things. And so it's really about putting together the subjective experience that the individual has with those labs, which is, what we do in functional medicine.
Right, and you just brought out so many points. And if anybody listening thinks their thyroid is functioning low, but your labs say not, this is what I want you to do. Look up the Barnes test, and you can do a basal body temperature chart and see if your thyroid is functioning low. But even if that's normal and clinically you have low thyroid, you can still have subclinical, what we call subclinical hypothyroidism. Right. And also what I want everyone listening to know is that fatigue is often very much normalized in our society as being a part of quote unquote normal aging. And I want to debunk that myth today. It is not normal to be tired because you're 40, 50, 60, 70. It is not normal, just like it's not normal to be overweight. Now I should rephrase that, because I should say that in America, we've normalized that. So the normal American, as they get older, is overweight and tired. But in other cultures, it's not so. And it's not so because they don't have some of the infectious and toxin agents and hormone imbalances and nutritional deficiencies that we suffer with. So there's always a root cause. And that's what doctors who are trained in functional medicine are designed to get at. And that's what Dr. Evans specializes in. So if you're hitting Starbucks every day, or maybe in the afternoon too, can't get by without coffee or Red Bull, and you're just feeling like you're dragging, there's always a reason. And you may not find the reason at the traditional route doctor's office. So you deserve to live a life that's full of vitality and has energy, and have the energy to do the things you love. And I know Dr. Evan loves to sing in musicals. I love to sing. I sing in the choir. You need to be out doing that. So just on a personal note, so do you perform in musicals?
I have in the past, yeah. Right now, I'm taking a brief hiatus, but yeah, I love musicals. I love seeing them probably more than performing in them. But fortunately, it's something that we love to do as a family.
And so where does joy come into creating brilliant health in your life and your patient's life?
So once people get to a point where they have more energy, that's when I start talking more about mindset, and starting, they can't really focus on that, while they're feeling like crap. And so when you get into mindset, that's when I start talking about a gratitude practice, just saying 3 things every day and really feeling that gratitude, because anybody can find 3 things to be grateful for. And it just changes your physiology. There was a great study in Harvard a number of years ago, just 3 things. Start changing all the limiting beliefs that I have. As I think about beliefs that are limiting me, I change them into empowering beliefs. And I keep a log of this, and I look at them every single morning when I do my daily practice. I'm looking at what are those empowering beliefs, and then what are those empowering questions. If I'm asking myself, why does my life suck and this person's life is great? Guess what? The brain is going to find the data for that answer. It's going to find that information, because it's such a great search engine. And that's not the questions we want to be asking. We want to be asking, who do I need to be in order to be, the best husband to my wife, the best father to my daughter? How do I show them how much I love them? How do I show up for my patients and provide exactly what they need in order to move them in a positive direction? So these are all of the questions that I ask myself every morning. And then I go into visualizations. So visualizing the future. The brain doesn't know the difference between reality and fantasy. Mm-hmm. And and we know this because, when you watch a scary movie, your blood pressure goes up, you're producing a lot more cortisol. And so saying these things and visualizing what you want in your future is so incredibly important. Your 90-day goals, your 180, your 365, your 5-year, your 10-year. And so that's what I do. And I look at my perfect day. What is my perfect day going to look like? And then, the universe has no choice, and this is getting a little spiritual here, but the universe has no choice but to conspire and create that for you. And so I encourage people to have a daily practice as well, which includes those things.
Yes, you're speaking my language, Dr. Evan. This is something I love to talk to people about. But your point is well taken that when you do have physical reasons, infections, toxicity, nutritional deficiency, to have chronic fatigue, mindset is probably not the first issue that needs to be tackled. And so I love that you address those physical issues first, but that you have the mindset piece, because you do want to ask the empowering questions, not the disempowering ones.
Right.
And that is really what will help propel you. And I think that you can learn how to harness this energy to create your life the way you want it. And so teaching patients those tools that it sounds like both of us have used, I think is very empowering, powerful stuff. And I can't wait to see what happens when you do help 1 million people transform.
Woot, woot.
Woot, woot. So I have to ask you, the name of the podcast is Her Brilliant Health. How would you define Her Brilliant Health?
Her Brilliant Health.
Yes.
So, I'm envisioning this woman with kind of her arms out, out in the sun. And it really is this balance, yes, of the mind, body, spirit, all of those things really operating on all cylinders, and somebody living a conscious life, where every single day they're working on improving, one aspect of their life. They're moving every day, they're dancing, they're singing, their mindset is awesome, and they see the positive in everything that's coming, the future. Their body is robust, and they're detoxing appropriately. It's operating on all cylinders. It's that balance that you talked about on all these different aspects: mind, body, spirit, health.
Yes, thank you so much, Dr. Evan. Dr. Evan Hirsch, fixyourfatigue.org. Go there to download his free book and learn more. Dr. Evan is the fatigue doctor, the one I would definitely go to and recommend if I were having chronic fatigue. And I will help you and support you in reaching 1 million people, because there are way more than that need this type of help. So thank you so much for your journey and for the work that you do. I know it wasn't easy, but it was for a reason, so that you could help other people suffering needlessly. Thank you so much for joining me today.
Absolutely. Thank you, Dr. Kyrin.
Thank you. Thank you for joining me for this episode of Her Brilliant Health Radio. Hopefully you're inspired to take action on some new information you received today. A step towards the bountiful, blissful, beautiful vitality that you deserve. If you have health topics and questions you'd like addressed, please message me on my Facebook page or visit KyrinDunstonMD.com and let me know. I'd love to help. Remember to share this podcast on social media and send it to your friends and family who could benefit from it too. If you love the show, please go right now to iTunes, write a review, and make sure to subscribe to the podcast so you'll be the first to know when future episodes are available. Thank you again for joining me, and remember, achieving optimal health isn't magic, it's science.